Thanks for joining us today. I'm Jen Harris, and of course, we have Dr. Bissell here to talk with us about what's going on related to COVID-19 in our community. If you have any questions, please feel free to ask those using the chat or the Q&A. And now I'm going to hand it over to you, Dr. Bissell. Thanks for being here.
Hi, Jen. Thank you so much, as always. Thanks, everyone, for joining us. I don't have a whole lot to say today other than we continue to see the trend in the right direction as far as cases. Our epi curves continue to show a decline, and they will be put on our NRV Road to Wellness website. But just for some perspective, today for the entire district, we had 14 cases reported. So those numbers are certainly trending down. Our hospitalization numbers are also trending down as well. The new CDC community spread guidance, those new tables put us last week with the update on Thursday. All 5 of our localities were in the moderate, the yellow range. Given what our numbers look like now, I do expect that we will all be down to the green range with the update this week. So we'll continue to follow things. It's a very promising sign. The weather's improving. Hopefully people take advantage of the spring weather and maybe, get some new perspective, get outside more, although I know this weekend wasn't great, and enjoy this relative lull. We are still doing wastewater surveillance, which I think is a great tool for surveillance. We don't right now expect to see any big jumps in cases before late in the summer or early fall. We do expect, that we might see something then. Again, we do expect that this will probably be regional and seasonal spread like most respiratory viruses are. So doing the wastewater surveillance might be a good thing to just kind of track things. And obviously we'll continue to track things globally and see what happens with any new variants that arise, because we still have a lot of vaccinating to do across the world to get people vaccinated and hopefully decrease the risk of any future variants. So I think that's pretty much all I had, and I'll go ahead and just take questions.
Great, we have several coming in so far. Let's start with Janae and Leanna. They are asking, throughout your career, they're asking some questions related to National Vaccination Day. So throughout your career in the medical field, how have you seen vaccinations transform, especially as we entered the COVID-19 pandemic?
So obviously the COVID vaccination effort, we introduced the mRNA vaccines. Those are not traditional platform vaccines, although like we said, they're not new technology. The technology is actually, been under investigation and is being used in cancer therapies and other scientific advancements. But this is obviously the first mRNA vaccines. So it's exciting that there are new types of vaccines. That's not to say that the old vaccines, the more traditional vaccines, aren't still excellent vaccines. And in fact, a couple of vaccines that have submitted to the FDA for emergency use consideration are more traditional platforms. One of them, the Novavax, is based on the protein subunit like hepatitis, and Covaxin is based on a whole inactivated virion, like the inactivated polio. So we do know a lot of people are still hesitant about the mRNA vaccines and have a lot of legitimate questions about them. So these other platforms might be something that people are a little bit more comfortable getting. As we've said for a long time, vaccines literally pre-COVID save millions of lives annually. And post-COVID, they certainly have saved an incredible number of lives. We know that the lion's share of people who get really sick and who die of COVID right now are people who are not vaccinated. So they are working. I think, people had this expectation that they were just going to shut the pandemic down, and that was not realistic from the get-go. So they are doing, what they're intended to do in that sense. I think everyone was disappointed that their efficacy, went down. But again, from a public health standpoint, they are keeping people, relatively out of the hospital and from dying. So that's a public health success. As we look at other vaccines, again, the reason that we don't see a lot of these other childhood illnesses is because of vaccines. So overall, very successful campaign, and has saved, immeasurable lives during the COVID epidemic.
Okay. I think you actually answered their second question. So where do you see vaccinations going in the future?
In public health, when we have a vaccine that is low risk and again, prevents the worst outcomes, we're going to advocate for vaccination over infection. We have to remember that, unfortunately, with infectious diseases, nothing is zero risk. So, it has to be all about, a risk-benefit assessment and trade-offs. These vaccines are low risk, they're not zero risk. Getting COVID is much higher risk for certain folks, those who are older, those who have comorbidities, than those who are younger. And so that's one of those things where, as we gather the data, we have to put the data out there, and people have to do, in conjunction, in collaboration with their physicians, with their medical professionals, an assessment, a risk assessment, and then they have to look at risk tolerance, and use that to have that discussion. As far as COVID vaccinations, I know there's already talk, and I saw the one question kind of pop up about a fourth booster shot. It would not be surprising that, there is a recommendation for an annual shot, like we have with the flu vaccines. And remember, any given year, the flu vaccine efficacy is not certainly in the 70s, 80s, or 90s%. Sometimes it's even lower than 50%. But my take on that, again, is 50% is better than zero, 40% is better than zero. And if it keeps you out of the hospital, it keeps you from getting really sick and dying, then it is doing something. So it wouldn't surprise me, but I still think we have a lot to learn about immunity from COVID, about people who've had COVID, about people who've had COVID and gotten vaccinated, about people who've not had COVID and been vaccinated. There's the components to the immunity. There's that antibody response, but then there's the cellular immunity and the immunologic memory. And then there's the component that respiratory viruses, you get that mucosal immunity, what we call that IgA immunity. And that's why, they tried the nasal flu vaccine, the inactivated flu vaccine. So we still have a lot to learn, but we are seeing, good progress. And again, even if the vaccines don't prevent people from getting infected, if they do prevent people from getting seriously ill, that's a success. And people who've had COVID, we have to acknowledge that, although that's not a preferred, we certainly don't encourage people to go out and try and get sick when we have vaccines. If they do have, or they have in fact had COVID, we have to acknowledge that that does confer some immunity. And it is a good immunity, because unlike the vaccines, which only address the spike protein, which is where so many of the mutations occur, having had COVID, you get antibodies to the spike protein, but you also get them to the membrane and the envelope proteins and the nucleocapsid protein. So, in that respect, you have somewhat of a broader immunity, which will help protect as well. And that's why there's been data out there that people who've had COVID and then get one shot of the vaccine have very, very good immunity. So there is no one size fits all to the vaccination effort, but they are an incredible tool as we fight infectious diseases. And this won't be the last pandemic. In the era of globalization and global travel, there will be other pandemics. So we have to learn from our response here. And the fact that, the vaccines came to being in literally months after the virus was sequenced, that's just a huge success story for public health.
Okay. I think you touched upon this, but I'm going to go ahead and ask it in case you want to add anything else. But what have you learned after 2 years of this COVID pandemic?
Wow, that's a long one. So, I've learned that the media, social media, politics, all of these have played a role. And unfortunately, I think all of them have contributed to a lot of divisiveness. People seem to be very much on the extremes. And like I said, nothing is zero risk. And so when you're looking at a response to something like this, you have to be realistic in your expectations. This isn't an infectious disease. Unfortunately, people will get really sick, and unfortunately, people will die. And we want to do our best to prevent, the morbidity and the mortality from it the best we can. Any measures, any policies that we implement, there's always going to be some trade-offs. And I think, because people have been so divided, there's almost this absolute, and it's this binary thinking, and that's been extremely challenging. So as I said, I don't believe there is a one size fits all to vaccinating. And I'm very pro-vaccine, absolutely very pro-vaccine, but it's a no-brainer for those who are higher risk to get the primary series and to get boosters. As you get to people who had COVID, you have to acknowledge, the immunity from COVID. And so getting the full series and boosters, I'm not sure that that's always going to be the right thing to do. Certainly people who are higher risk, and are immunocompromised, younger people, that risk benefit, becomes a little bit more equal. And so that's why I encourage people to have those discussions with a trusted healthcare provider who knows their health history, and they can have those risk discussions. The masking, has become an all or none. If you don't support mandates, and same thing for vaccines, if you don't support mandates, then you're anti-mask or anti-vaccine, and that's not true. And the masking, again, there are different types of masks. There's different compliance issues. And to just assume that there are no harms from masking, I think we do need to look at the harms from social isolation, from masking, and those kinds of things as we're informing our policy. And I think that's coming to light. And it's just pitting people. It's almost become part of their identities, and it's just pitting people against each other, when in fact, I think the most reasonable thing is in the middle there. But if you don't identify on one extreme or the other, it seems like you're labeled as the other extreme, as opposed to that middle ground. And that's been a real challenge during the pandemic, to try and navigate that middle ground and bring people more towards the middle. When social media especially tends to divide people more, politics unfortunately tends to divide people more. So I would love to think about this in a unified way. Usually you think about crises like this unifying people, uniting people. But I continue to work with my team. We have regular discussions. We look at the data regularly. We look at papers and publications regularly, and we try to inform our guidance based on that, to help people navigate this in a way that keeps them as safe as possible, and also lessens the impact, the unforeseen, or the negative consequences of our mitigation strategies. And we're looking back over the past 2 years. We're going here locally and at the state level, and I'm sure at the national level, we'll be doing a big after action report and evaluation, with some looks at what we've done, what was successful, what we could do better, to prepare ourselves for the next time. Because as I said, there will be other pandemics. It's not a matter of if, it's a matter of when. And I don't think we'll be so lucky that it'll be another 100 years.
Thank you for that. Alexis is also asking, what are your thoughts on the evolution of treatments now that there are vaccines and the pills to help treat COVID?
So yeah, we're not in the same spot we were in March of 2020. And I think, we have to acknowledge that. We do have vaccines, which have been very, very effective. And we do have treatments. And those will continue to evolve as well. And again, we need to look at those as part of our tools, to really minimize the bad outcomes and the effects of COVID-19 moving forward, and allowing us to kind of progress to where we get back to some normalcy and we start working on a lot of those negative impacts. I mean, we know that substance use and overdoses are way up. We know mental health has really taken a toll on everybody's mental health. So we have to start looking at all of those negative consequences and working on them, and they will continue to evolve. And that's the beauty of science, and that's the beauty of developing these new treatments and whatnot, so that we can learn to live with COVID, recognizing that it's not going to go away, but it's not going to give nearly the disruption that it caused in these first 2 years. So it's a very positive thing. It's very encouraging. And acknowledging that we have to learn to live with COVID isn't at all minimizing COVID. It isn't at all saying, oh, we're just going to move on, COVID's done. Again, there's that extreme, people are critical that those who are acknowledging that we do have to learn to live with COVID are just throwing their hands up. But we're in a different place than we were 2 years ago. And I think we have to be happy with that. And we need to be on to that.
All right, Nick is asking, when you first started talking today, you stated that there were just 14 cases throughout the New River Health District. And he's asking, how does that compare to previous laws that our district has seen to date?
How does it compare to previous numbers?
Yes. And has there been a law in the data like this one to date? Or is this
So
the
our
first
case
time
numbers
we've seen it?
have been dropping. So last week, a couple of weeks ago when we were at our peak, we were getting several hundred cases every day. And Mondays, because of a lower testing on the weekends, would be down a little bit, but then Tuesday, Wednesday, Thursday, they would be up in the several hundred case range, and that has just progressively declined. So today was 14. It's a Monday, probably not a lot of testing over the weekend. We don't expect to see much more over the rest of this week. It's following the pretty classic epi curve that it's followed throughout other places in the country. We were just a little bit further behind. So we expect cases to be per locality kind of single digits this week, and maybe for the entire district just in the teens to maybe 20s. We certainly don't expect 100 or hundreds of cases a day.
Okay,
so
Jean you mentioned this earlier. You saw that the question about the fourth shot came through, but Jean is saying Pfizer says now a fourth shot might be needed. If that's the case, are you worried there may be some vaccine fatigue?
Oh, absolutely. And I already see that, as I'm scanning social media and emails that I get and phone calls I get, how much longer is this going to go on? How many vaccines are they going to want us to get? So again, I think, when we're talking about immunity, we're talking about those neutralizing antibodies, which are generated or stimulated by the vaccine, but there's also that cellular immunity and that memory. And so, I think, as I said before, it would not at all surprise me, because I do fully expect that this will be seasonal. That we'll probably see cases rising like we do with the flu in the fall. So I do expect that there may be annual, or every so often they may ask that we get boosters. They may be combined shots, flu and COVID boosters. Now that our cases are dropping significantly, and we're not seeing another variant that we're super concerned about, the B2, the Omicron B2. It looks like people who've had the original Omicron will have a good amount of immunity to that one. So, we certainly don't expect to see a big surge. We do know that after booster shots, the immunity does wane. Those neutralizing antibodies do wane over a period of time. So, if we do recommend further booster shots, I think we have to look at the timing, and we have to look at that. And I do think we need to look a lot more carefully at the cellular immunity aspect and the data about cellular immunity. Because I do expect that there will be vaccine fatigue, especially if we come around and say, oh, we're going to do a 4th dose now, and then we're going to ask you to get a booster in the fall. So I know the Pfizer CEO came out and said that. I'm very hopeful that the CDC and the FDA committees, the ACIP and the VRBAC, the Vaccines and Related Biologics Advisory Committee, will take a hard look at that data before making any blanket recommendations like that. Excuse me.
Okay, so you mentioned that COVID will most likely be an annual event. That was Tom's question. And he's also asking, what are the first signs you will be looking for as each year? Is there going to be a COVID time when it may be coming to the forefront?
There's a lot of stuff coming out now. Dr. Offit, Dr. Osterholm, they all were part of a big committee that put together kind of, an assessment of how do we move forward. And, we need to look at COVID like other communicable diseases. So we talk about surveillance. I mean, that's what we do with flu. We look at surveillance. We follow what happens in the Southern Hemisphere because they're kind of the opposite we are. So we kind of know what their flu season is like and predicting our flu season. And then we start looking for when respiratory illnesses start to increase. And obviously, as the respiratory illnesses increase and symptoms increase, the testing increases, and we get an idea of when flu has hit what regions and what flu it is, if it's flu A, flu B. Same thing with COVID. We'll monitor for COVID-like illness and COVID symptoms. We'll monitor emergency department and urgent care visits. We'll monitor testing that's done. And then we do have the wastewater surveillance, which has been done across the state. Now, I forget how many, but I think there's like 26 or 28 wastewater facilities where they've been looking across the state. And the COVID numbers out of the wastewater have gone way down, as we've seen in our case numbers. And so that's one method of doing surveillance, because that is what we call like a leading indicator. So if you start seeing COVID numbers increasing in the wastewater, you can expect that you might start seeing more symptoms and more cases diagnosed, whereas hospitalizations and deaths tend to be a lagging indicator. So we'll use all of those surveillance methods and those good public health tools that we use for other communicable diseases, and we'll wrap COVID in with that. And I think one of the realizations out of this is that we need a much more robust data tracking structure. The CDC needs a better one. Local and state health departments need better data tracking tools, so that we can do that surveillance. And that's the way of picking things up in an early, at an early time, so then we can manage our response more effectively.
As always, we really appreciate your time. That appears to be the last question we have, and we look forward to next week.
Yeah, so hopefully next week I'll tell you that on this Thursday's update, we're all in the green, which is low transmission. I do expect that to happen. And again, it's a light at the end of the tunnel, which is most welcome, and it's a time we can kind of play catch up and prepare. So thank you so much. And Jen, thank you as always.